present AI Sarosh today, which is supported by RDRC Canada and organized by GTA Foundation and BHC Global together. And this has been in the efforts for many months, I believe my colleagues would tell that this has been more than 10 years in making for some people here. And this was sort of a passion vision for these two people right here, Dr. Imran and Deepak Ji. And this co-design workshop and this consortium that is now supported by RDRC has brought together people from two completely different elements of the world, that is AI and SMRH. So AI, like artificial intelligence, used for sexual, reproductive, and maternal health in South Asia Hub, something that has been sort of missing when it came to change makers in the South Asia Hub. This is just a few members of our team who have been crucial in making everything here happen. So some of the key elements of sexual, reproductive, and maternal health issues that have been highlighted so far. I would rather talk about the fact that has been highlighted during the workshop as well. So there was one small question I had the pleasure of doing, forcing basically people to creatively think in this process and kind of dig deeper into why they are doing the work that they're doing. We had 9 proposals presented during this workshop that included cases of and solutions for mental health purposes, postpartum depression. It had included for AI chatbots for adolescents. It had included a lot of work related to paternal care, maternal care, and more importantly, it's moving towards adolescent sexual health as well, which is not talked about enough in South Asia. So this is basically the word knowledge hub that is lovely used by my boss a lot. Dr. Imran, he keeps using the word knowledge hub, so that's exactly what it was created for. So people from 4 countries being in one room, trying to co-create and come up with different solutions, and how to have a multidisciplinary approach towards developing AI solutions for things that you might not even consider creating AI solutions for. So someone had recently mentioned one of our proposals was also about maternal postnatal care as well, and how so many of these elements require such deep strategic thinking from, let's say, the first month of pregnancy for a woman till the last month, even if we're talking about just that. And then even today, someone had mentioned that how even prior to pregnancy, how much of the contraceptive time is also important to be talked about, important to be developed. Healthcare for our healthcare systems have to develop in that order now, and it can be done well with the support of AI, and how to co-develop that. So that's what this workshop has been about, and it have had just the main themes of it has included maternal health, family planning, adolescent sexual health and reproductive health as well, maternal mental health, and sexual and reproductive health services. So again, we're something that you wouldn't hear easily talked about in South Asia, right? So, but you're having a room full of change makers not only talk about it, they're making solutions for it. And it's been done quite creatively throughout this session. We are already at day 3. You can visit the end of the room to see the artwork that's been developing over time, and how these stories are also equally, everybody going through this process is becoming a story in its own. Some of the projects that have been included, so we have had almost 4 projects from Bangladesh that included aspects of improving well-being, aspects of improving power source AI services, how to work on something that has really literally stuck by my heart is the project that's called Ma. It's on AI used for post-maternal, postnatal care, and how postpartum depression actually leads to. So their own case study was one of the postpartum suicides. So that has led to a wonderful aspect of just opening the horizon for women to talk about now. Then we have 2 projects from Nepal that have focused on cervical screening as well, and then there was one that is AI-powered fetal ultrasound services that will help in the concept of early detection, and the concept of early care leads to much less mortality rate for children and safety for mothers as well. Then we have 3 projects from Pakistan as well that included one of our AI experts from NUST. We have one again on postpartum depression from Al Khan University. That means that it's stressed enough now to have enough case studies about it to be worked on. And then there was a maternal health care with machine learning as well. So it's about predicting conditions. Again, we're moving towards, so AI has that skill. We haven't used it yet. AI already has that skill to kind of predict what can go wrong for you. So just to modify a system is a wonderful step that we have done here. One project was also from Sri Lanka. Kapilaji has been very assistant of it. That National Birth Cohort Study. So this is by University of Colombo, and we're very grateful of the hosting that we have received in Colombo as well. This has been a really wonderful journey. So our expected outcome, which I believe we already have achieved, is that we had to develop a knowledge hub and a network for South Asia and form SMRH delivery approaches in a way that would be sort of applicable in not just one country but more. So how to actually learn from it. So what was really interesting, because I am an arts lead here and I have forced people to think creatively. The boards you see at the back, they had to do some vision mapping there. While you're exiting, you can see some of the canvases they've done on their own well-being. So it's more to humanize the AI approach as well. So when you put a gynecologist, that's one of our wonderful doctors who had joined us, with, let's say, one of our AI experts, and or someone like a mixture of both. We have had all sorts of people here ideate together, which made the approach so much more human today. I mean, I myself felt very energized after the panel discussion today, because that panel existed of every single one expert of it. So if you have an AI expert, you have an engineer who can actually solve that problem for you. So that's exactly how co-creation works, and that's somewhat the Knowledge Hub purpose was for. And it has been based on the fact that we can implement AI-based SMRH delivery approaches. We had to understand key issues. One of our key objectives was what the key issues can be, what the gaps can be, what the challenges would be. So you see that even in our panel, we had this discussion a couple of hours back that the feedback that we get from, let's say, the Sri Lankan government for healthcare, it's completely different from what Pakistan government would face. The challenges that you might face on different aspects. So we had a chat about how to work with the challenges, then where the gaps would be. So there is a concept that where even as an artist myself, I have a background in architecture too. So what happens is that AI, I feel, can take my job. That's the first thing that we come up with. We haven't seen it as a trial tool yet. We haven't seen it as something that can aid the job as well. It can aid it better. Someone had pointed out that the doctors themselves might be kind of alarmed if they had AI assistance in this process. So that's one of the challenges that people want to collectively work on, so make a more humanistic, more rational approach, and the system approach can also be more rational. Then there is evidence generation of multidisciplinary approaches. So again, multidisciplinary, 10 people together with 10 different backgrounds, coming up with one solution that checks it off right there. And then when they kind of create that evidence, someone had mentioned today about clinical trials as well, on how AI can be a clinical trial on its own and how to test it out. I mean, that's a wonderful approach. And how to test it out with how comfortable women are with it. So that, because this is what we are aiming for, and how improvement of SMRs through the application of AI at national, regional levels would work. So again, the one main reason why you all are in this room and why Deepak Ji has really worked hard for this to be out there in the world was because that we want this to be reached out. We want to reach out. We want to make it more visible. This has to reach out at national and regional levels where this can be shown that, okay, improvement in sexual, reproductive, maternal health can also be done through AI. And this is something that now South Asia Hub by Art Garcia is working on.